Welcome to ICU Primary Prepcast.
Hi, I'm Maddie.
Hi, I'm Swapnil, and welcome to new episode of 2025. Maddie, Happy New Year, and how's your new year been so far?
It's been pretty good. Had a really good time with my family who came from overseas for about 6 weeks. That was great. And then now just getting into the new year, although it's already February. I don't know how that happened. Feels like it was just 2024.
That's right, the time flies by very quickly. So let's dive into today's snippet. So can you describe the work of breathing and its components? And also, can you briefly outline the efficiency of the lung?
So work of breathing is pressure times volume, or force in newtons times distance in meters. And this generally measured in joules, where 1 joule is the amount of work done when a force of 1 Newton displays an object by 1 meter, or the work required to move 1 litre of gas through a 10 centimetres of water pressure gradient. We usually express work of breathing as work as per unit volume. So the normal value in healthy individuals is approximately 0.35 joules per litre. And if we're thinking about work of breathing, it consists of 2 broad components, and these are elastic work and non-elastic work. So we'll start with the elastic work. This is approximately 65% of the total work of breathing, and it consists of work done to overcome the recoil of the chest wall and the elastic recoil and the surface tension of the lung. So we think about the recoil of the chest wall first. When we think about compliance, it's the inverse of elastance, or elastic recoil. So increased compliance is decreased elastance. And the compliance of the chest wall is the change in the lung volume per the change in the pressure between the atmosphere and the intrapleural space. So the factors affecting the elastic recoil of the chest wall include pathological fractures. So you might see it in those patients who have significant burns of their chest or scarring of their chest, if they have large volume ascites or other intra-abdominal pathology, or any deformities of the spine. This will all decrease the elastance. Other things that affect the elastic recoil of the chest wall are age. So there's increased elastance with age, obesity, which actually increases the chest wall elastance, and the posture, where supine position has increased elastance. Then if we think about the elastic recoil and the surface tension of the lung opening is resisted by the tendency of the lungs to collapse, which is again the elastic recoil of the lungs, and the surface tension in the alveoli. And the elastic recoil is directly related to lung compliance, like we talked about for the chest wall compliance. So for the compliance of the lung, it's the change in lung volume over the change in pressure between the alveolus and the pleural space, which is the transmural pressure gradient. Then we can think about the factors affecting the elastic recoil of the lung, which are increased lung volume. So increased lung volume increases lung elastic recoil, which decreases compliance and increases work of breathing. Similarly, pulmonary blood volume. So any increase in venous congestion reduces the compliance of the lungs, which increase the work of breathing. And you'll see this in things like pulmonary edema with patients who have increased work of breathing. With age, there's a loss of elastic tissue with age, which increases the compliance and actually decreases the work of breathing from just purely the lung perspective. And then there's disease factors. So things like pulmonary fibrosis will decrease the compliance of the lungs because of increased stiffness, and this increases the work of breathing. And then the factors affecting the surface tension of the alveoli are mainly all to do with surfactant, which reduces the surface tension. So anything that reduces your surfactant level will increase your work of breathing. We know that elastic work is increased when breathing is slow and deep. So then coming to the non-elastic work, this is approximately 35% of total work. So it's a less proportion of the total work of breathing compared to the elastic work. And this is work done to overcome the tissue resistance and the airway resistance. So the tissue resistance is the pressure required to overcome the viscous force within the tissues as they slide over each other. And this accounts for approximately 20% of total resistance in healthy patients. We don't think a lot about the tissue resistance in this case. The main factors we think about is the airway resistance. And we know that the major site of airway resistance is medium-sized bronchi. And that resistance equals, for laminar flow anyway, equals 8 times viscosity times length on pi radius of the bronchi to the power of 4. So therefore we know that the radius is the major determinant factor of resistance if a laminar flows. There's something called, when we think about the flow in airways, there's laminar flow or there's turbulent flow. So laminar flow occurs when the streamlines of air are parallel to the sides of the tube, whereas turbulent flow occurs when this flow rate is increased and there's disorganization of these streamlines. And there's a thing called Reynolds number, which can help us predict whether the flow will be laminar or turbulent. If the flow is within the airways, the gas flow consists of both laminar and turbulent flow, but it's actually generally just turbulent flow in the first and the second generation airways until about the 11th generation of airways, where it becomes laminar. So if we think about Reynolds number and we think about resistance, the factors affecting airway resistance, one are the flow rate, because increased flow will increase the resistance when flow is turbulent. The lung volume, so decreased lung volume increases airway resistance. And then things affecting the airway size. So we've talked about how radius is really important for determining the resistance of a vessel or a bronchi. So things that affect airway size, such as bronchial smooth muscle tone, such as bronchoconstriction or intraluminal obstruction, will all cause increased resistance and will therefore increase your work of breathing. Finally, things like density of gas, so decreased density reduces resistance, but only for turbulent flow, or the viscosity of gas, so increased viscosity increases resistance in laminar flow, but actually decreases Reynolds number, which may promote laminar flow, so that it can have a variable effect on resistance.
Thanks, Maddie. A lot to answer in this part of the question, and this is only considering 85% of the marking weightage. So using the diagram for the work of breathing, which is available in West, is quite useful. And then you can draw that diagram and explain each component of work of breathing. Now, moving on to the second part of the question, can you briefly outline the efficiency of the lung?
So the work of breathing is performed solely by inspiratory muscles when at rest. So approximately 50% is expended as heat during inspiration to overcome the forces opposing inspiration, and the remainder is stored as potential energy in the elastic tissues of the lung and chest wall. This then becomes a source of energy for expiration, which is expended as heat during expiration to overcome the frictional forces that oppose the expiration. So efficiency is the useful work on the total energy expended, or the oxygen cost of breathing times 100, and normally it's approximately 5 to 10%. The O2 cost of breathing at rest is very small, but this can increase to up to 20% during strenuous exercise or during disease. And we know that efficiency is reduced when minute ventilation is increased in pregnancy and in respiratory disease. And there's a bit more information if you look at nuns. I mean, I personally was not a huge fan of that book. It was a lot of detail. But like, if you do look at nuns, there's a graph in chapter 6 that looks at efficiency.
Yeah, so lung efficiency, it was kind of asked for the first time recently. So this has not been asked before. And then also finding in Canon or other textbook is a bit hard. So I think nuns is probably to go for these answers. Thanks for covering that.
Even on the like when I was looking into it, even on the internet, it's very hard to find like a definition and stuff of efficiency. So good luck.
That's right. So that's the end of our today's snippet. We'll be back with another snippet in a few weeks' time. Till then, goodbye and have a nice time.
Thanks for listening, and see you next time.